Hansen is out for tonight, I'm John Paikin. Tonight we're going to be focusing on a debate that is shaking the nation. What are the benefits of online therapy versus going to see a therapist in person? Joining us, we have Tracy Prusik and Michael Onu, experts in in-person therapy, and Megan Reardigan and Mary Beth Nosak, experts in online therapy. Let's start things off with you, Michael. Tell me a little bit about in-person therapy and what makes it beneficial to patients.
Well, John, that's a good question. There are a variety of benefits of in-person therapy. Besides the obvious benefits like not having to worry about having a stable internet connection, or making sure the therapist you're communicating with online has the required documentation to prove they can practice, one huge benefit of in-person therapy is it allows for the transmission of nonverbal communication signals, which is a very important part of psychotherapy. Through the therapist's observation of body language and the tone of voice that the patient uses when they speak, therapists can gain more insight on how the patient is really feeling. This form of communication is often not possible if the interaction between the patient and therapist is strictly online. Although online therapy is more convenient for most people, quite frankly, it's not enough to treat severe mental health disorders that make the patient a danger to themselves and others. Another positive of in-person therapy is because since it's been around for longer, there's more opportunities for therapists to gain more training and skills to better help their patients. Also, just some on a side note, a lot of online therapy websites require you to be above the age of a minor, so in-person therapy is a little bit more accessible. Those are basically the main benefits, I'd say, of in-person therapy versus online therapy.
Now, those are some very interesting points, Michael. You mentioned certain practices not having their own proper documentation for these online apps that have been released recently. And then, of course, a huge point is the nonverbal signals that are being communicated between the doctor and patient just by being in the same room and having a face-to-face conversation, which can drastically improve the quality of the confrontation that's happening. And then, which I didn't know, is no underage access for these online apps. You have to be 18 years or older, which some mental health disorders develop much younger than that, and people will need the help younger than that. So online therapy is not a viable option for these people. So now, Megan, you seem to have a different perspective.
Yes, John, I do have some pros on online therapy. The first is saving money. So according to Talkspace, online therapy can be cheaper than that of traditional therapy. Even with health insurance, traditional therapy can cost an average $75 to $150 per person, and the discussion only is limited to 45 to 60 minutes, whereas online therapy can be as low as $32 a week for unlimited discussions. It's also very convenient. There are no commutes, no scheduling, and it's on your time. It can be as easy as sending a text message to your therapist, and you can feel comfortable sitting at your home, workplace, and school. You can express yourself in many ways. Sometimes clients need more than just a text message, and that's why online therapists are able to write, talk with or without a video, communicate through certain devices, and even send pictures. All are provided so the client can express more feelings if needed to. Another beneficial factor is that it can be anonymous. Certain online therapists do not require a person to give information except for a method of payment and an email if an individual does not want to be known. It is good for people with social anxiety. If you aren't very good with face-to-face first-time visitations, this could be for you. It can foster a deep connection. Sometimes being online or over the internet or phone makes people feel more comfortable. You can be even more open with your online therapist than you can with the traditional therapist. It provides an access for people who cannot get into an office. Sometimes people live over an hour or 2-hour drive from a therapist's office. Also, for people with disabilities or handicaps, it may be challenging to get to an office or simply you cannot drive. Sometimes people who do not have enough time need online therapy. Therefore, online therapy can be beneficial to people.
Thank you for that, Megan. You had some very good points there with how cost-effective online therapy can be compared to in-person therapy, with sessions astronomically higher priced than online therapy. Another great point is that online therapy is all around your own time. It's convenient. You can schedule the appointments whenever you would like. And another very key point is that you can remain anonymous if you would like to. So now, after this, we'll be right back after a short commercial break.
does that bother you?
Why does it bother me? So easy a caveman can do it?
Well, it's just a commercial.
Okay. Well, what if it said, Geico.com, so easy a therapist can do it?
Well, that commercial wouldn't make sense to me.
Why not?
Well, therapists
Are what? Smart? My mother's calling.
Welcome back to Updog Reports. And now we move to Tracy. Why would a patient choose in-person therapy over online therapy?
Well, there are many reasons why someone may want to choose in-person therapy. When thinking about going to therapy, you need to find out what works best for you. And with online therapy, you're limited to just that form. There are so many other types of therapy available, like music and art therapy, that you could be missing out on. Another point of view is that when taking part in in-person therapy, your body language and your eye contact are important factors. And those factors need to be taken into consideration because they can reveal more about what you're feeling. But when you partake in online therapy, you lose that connection. The internet may be lagging and may cause the image to blur, and you can't see your whole body in the whole frame. Also, when you're on video call, most people tend to look at the camera rather than the screen, thus making it harder for the doctor to see your eyes. You will most likely be looking down and not at the doctor. Some people also may choose to use their cell phones to partake in therapy, and they just may be chatting a doctor. The doctor cannot always get a clear sense of what you may be feeling or what may be happening because the text is so vague. And this could be causing a big problem with miscommunication, when the doctor can read it one way but you mean it a totally different way. Many people also think that online is better because they can stay anonymous. Yes, that is true because you can hide behind your screen and you can create a fake name. But with that doctor, you're creating a personal connection, and you have doctor-patient confidentiality. So anything you tell them directly, they can't repeat. So the difference is you're just putting a face to the name, which may be uncomfortable for some people, but ultimately it will be better because the doctor will get a better sense of who you are. Another huge factor to think about is the credibility of online counseling. You have to stop and ask yourself, are these real doctors or are they just random people who created an app? With apps, you never really know who you may be talking to, and nowadays with technology, somebody could be hacking into that app or whatever form of technology you're using, and they may be able to see what you are talking about if that kind of security concerns you. Finally, another part of why it's better is people who may be struggling with a mental health disorder, they may be a threat to themselves or society, and through online counseling, they can hide behind that wall and your doctor can't really get a true sense of who you are and what may be happening with you.
Thank you for those very good points, Tracy. The different types of therapy, such as music and art therapy, can be very helpful for some patients that normal therapy just isn't getting across to them. And then once again, the body language and mood of the room prevails as a very great point. And then once again, speaking about the doctor-patient confidentiality is a very, very important part of in-person therapy because with the online apps, you never know who you're talking to and if that app is actually legitimate. So now we'll take a break for a minute for a word from our sponsors.
Not enough hours in the day to get to your counseling appointment? No problem, we have you covered. Life Cycles Counseling is now offering online counseling specials. Hi, I'm Dr. Dina Silvestri. All you need is a computer and internet access, and we can reach you no matter where you are, home, office, or traveling abroad. I wanted to make it easier for you to become the more authentic you, and for you to achieve balance. I hope to see you for online counseling soon.
And now we're back here in the studio discussing the hard-hitting therapy debate. Mary Beth, more and more patients seem to choose to go the other direction and utilize online therapy. Why is this the case?
Well, John, it's pretty simple. Some patients are less likely to divulge as much information because they're feeling judged by the therapist that's sitting right in front of them. And when this happens, they're less likely to get as much out of the therapy session. And it's also really hard to find time in busy schedules nowadays to actually make an appointment and go to a doctor's office and sit there for 45 minutes, an hour, however long the session may be. As on top of that, transportation expenses can be pretty hefty, especially when you have to drive 20 minutes just to go see a therapist because you might not have a therapist in your town. You have to drive to the next town to go see a therapist. So gas money and other travel expenses can pile up pretty quickly.
All right, thank you, Mary Beth, for those great points about online therapy and how it's a better form of therapy than in person. The patients are less likely to reveal information about themselves if they are uncomfortable in just the face-to-face setting with a doctor. And then another very important factor is the time constraints that travel and just going to a therapy office and spending an hour there a few times a week just clogs up your week to do everyday activities. So now we've heard some great points here tonight from both sides of this debate, but ultimately the choice for online therapy or in-person therapy is up to the patient. Not one form of therapy will work for everyone because everyone has different needs. Thank you all for joining us tonight in this debate on a very heated topic of online therapy versus in-person therapy. I'm very sad to say that this is my first and last time as the anchorman for Updog Reports. And for one final time, this is me signing off. Updog out.
At your home, workplace, school. Okay, yes, John, I do have some pros of online therapy. It can be as easy as simply sending a text message to your therapist. You can sit comfortably. Why?
The doctor, so that just deters your eye from the I don't know. And it may be too vague or not vague enough. Does that make sense?
Too vague or too specific?
Yeah.
Wait, I didn't mean to. I meant one. I don't know if that can be a bumper.
Well, John, that's a good question. There are a variety of benefits of in-person therapy. Besides the obvious benefits like not having to worry about having a stable internet connection and making sure that your communication often is not possible when the interaction is strictly online because you don't get to see how your patient is oh, I messed it up.
Before, some patients are less likely to die. Well, John, it's pretty simple. So I can't look at you. In front of them. When this happens, why does that sound awkward?
Sick and Michael Onu, experts in on-person. Oh wow.
Go.
And now we're back here in the studio discussing the hard.
We ready for your close-up?
Ooh, that did not
I
work.
shaved this morning. Different needs. So now, thank you for all of you for. Wow.